I'll be teaching about this entire abdomen inspection, palpation and percussion later, but before that, only for the ascites, I've just put few slides so that you will be oriented when I teach that. Inspection, first, abdominal distension, the patient is going to have flanks full, abdominal distension with flanks full. The umbilicus will be everted or it will be smiling, okay. Abdominal striae will be present, okay, because of stretching of the abdominal wall. Diverification of recti will be there. What is diverification of recti? This is rectus abdominis muscle. This is transverse abdominis and obliques. So this is the linea alba. So when there is giving away of the rectus abdominis muscle because of increased intra-abdominal pressure, this banana shaped swelling is going to come in the anterior abdominal wall. This is called as diverification of recti. How do you check for this? You ask the patient to lift their head, or you will ask the patient to lift their feet. If they are able to do, when they are doing that, they will have a bulging or protrusion in their anterior abdominal wall. Next is palpation. Mainly we will go on to the measurements. This you have to see for the abdominal girth, which is usually taken in the upper border. The landmark for this is the upper border of the umbilicus. Around that area, we usually measure the abdominal girth. Always should be measured in the same position every day. Should not measure it in one place on day 1 and in day 2 in a different position. No, always in same position. So mark the points where you measure the abdominal girth. The next one is XU. XU is distance between the xiphisternum and the umbilicus. Measure this. The distance between the umbilicus and the pubic symphysis. Measure this. So this distance is called as XU, xiphisternum umbilicus. This distance is called as UP, umbilicus and pubic symphysis. So this distance divided by this distance, if it is, usually it is 1.6. 1.6 is normal. If it is more than 1.6, which means the umbilicus is slightly pushed down, it means the patient is having ascites. If it is less than 1.6, the patient might have a pelvic tumor which needs evaluation. So this is the distance between xiphi and umbilicus divided by distance between umbilicus and pubic symphysis. So next we will go on to the grades of ascites. So what is grade 1? Grade 1 is puddle sign. We don't use it anymore because it's slightly embarrassing for the patient and difficult to put the patient in this position. This is the position for, which is arm-knee position with a horizontal back. This is the position for puddle sign. So now which portion is dependent? Umbilicus becomes dependent portion and the fluid gets collected in umbilicus. Now if you percuss here, the patient is going to have a dull note because there is fluid there. This is called as puddle sign. It can pick up, it is said to pick up 120 ml of fluid also. But yes, grade 2, shifting dullness. So we percuss from the xiphisternum. So I hope you will understand this. This is the abdomen. This is xiphi. We start percussing from the xiphisternum downwards and we find the area of maximum tympanicity. So see, for example, this is the umbilicus. Usually this maximum tympanicity area will be around the umbilicus. So we find the area of maximum tympanicity. So we percuss from xiphisternum, we come downwards, find the area of maximum tympanicity. So from there, we don't take the pleximeter finger off. With that, we go laterally, parallel to the abdomen. We go and find the area of maximum dullness. So, and we have to find out if it is a continuous dullness and we have to see if it continues till the flanks. Now, tell the patient to turn to the lateral position. When the patient turns to the lateral position, you wait for 30 seconds and you percuss at the same area again. This dull note will turn into tympanic note because the fluid which caused the dullness has been moved to this side and this is going to give a tympanic note because of the air. Okay, this is called as shifting dullness. If you have any doubts, you can ask me later. Grade 3 is horseshoe dullness. Horseshoe dullness is, let's say this is the abdomen. This is the xiphisternum. Okay, you start percussing in the midline from the xiphisternum to down. So you find first dullness point here. Okay, this is the umbilicus. First dull point is here. Mark it as 1. Now you go laterally here. Wherever you find the first dullness point, mark it as 2. Go again here, mark it as 3, mark it as 4, so on. You keep going. 7, 8, 9, 10. So finally this would have formed an horseshoe. This is called as horseshoe dullness. Okay. And there is something called as reverse horseshoe. This reverse horseshoe is seen in ovarian tumors. Okay. And what is grade 4? I've shown here. Grade 4 is fluid thrill. Fluid thrill is you ask the patient to keep their hands in the midline and you tap on one side, percuss or tap on one side and feel the thrill on the other side by keeping your hands. So you tell the patient itself to keep the hands in the midline so that there is no skin transmission occurring. This is fluid thrill. If fluid thrill is present, it is grade 4 and the patient's fluid is minimum 2.5 liters.